Hello. I'd like to welcome people to the Mind Report. My name is Paul Bloom. I'm a professor of psychology and cognitive science at Yale University, and I'm very pleased to be talking to my old friend Barry Schwartz. Barry, why don't you introduce yourself?
Hi, everybody. I'm Barry Schwartz. I teach psychology at Swarthmore College, small college outside of Philadelphia. I've been here since 1971, since before they had even typewriters, let alone computers. So I'm an old hand at this, and I welcome the opportunity to talk to Paul.
So there's a lot I want to talk about. One of the things, you're known for several research programs and several ideas, but I want to start with the so-called paradox of choice, a view of yours that I think has real implications, is I think controversial. I think it's interesting and really has a lot to say about our everyday lives. So maybe you could just start by saying what the paradox of choice is.
Sure. Pretty much everyone in places like the U.S. and Western Europe has subscribed to a view that's perfectly reasonable, that since freedom contributes to well-being and choice contributes to freedom, choice contributes to well-being. And since some choice contributes to well-being, more choice should contribute even more to well-being, so that we should take every opportunity to enlarge the domains in which people have choices to make, and also enlarge the number of choices that people have available within each domain. And it doesn't take genius to see that one of the most striking differences between the year 2013 and the year, let's say, 1963, is that there is no area of modern life where people are not awash in options. Trivial things like what you buy and where you eat and what you eat, and non-trivial things like what you study, what job you take, where you end up living, what kind of romantic relationship you have, what kind of family structure you have. It's pretty much the case that it is up to us to shape our lives in pretty much any way we want.
And on the face of it, that sounds terrific.
On the face of that sounds completely terrific. It's like everyone has died and gone to heaven. This is the ideal world for human beings as we understand them. And philosophers would argue it's the ideal world, even apart from how good it is for us. It's the right thing to do because it's important for people to be autonomous agents, authors of their own lives, authors of their own actions. So this is all good. So where's the paradox? The paradox is that there's literature, and it started coming out 15 years ago, suggesting that although there's no question that choice is good, there is real question that more choice is better. That is to say, it looks like a point is reached where instead of being liberated by choice, people are paralyzed. If they overcome paralysis, if there are too many options, they end up making bad decisions. If they make decent decisions, they're less satisfied with them because they've chosen from a large choice set. So if I go to a restaurant that's got 30 entrees, I'll have a hard time choosing anything. I may well choose the wrong thing. And even if I choose the right thing, I'll sit there eating it and thinking about all those wonderful other things that I said no to. And I end up dissatisfied with my meal. So all of this is paradoxical because the logic is, if you don't want all this choice, just ignore it. Mm-hmm. If you're happy alternating between cornflakes and Raisin Bran, go for it. And ignore the other 140 cereals. And if I don't like cornflakes and Raisin Bran, the world is my oyster. I get to choose other things. So it can't possibly, what economists would say, is adding options is a Pareto improving thing. It makes somebody better off, makes nobody worse off. How can anyone be against it?
As I understand it, you have two logically independent objections to choice, or problems with choice. One is paralysis, in that if you're faced with 20 options as opposed to two, it's just harder to choose and the quality of your life suffers. And the second is regret, which is having chosen my one, if I had 19 other possibilities, I'm more likely to regret my choice than if I had one other possibility. Do I have that right?
Yes, but it's not only regret, because regret implies I made a mistake. And certainly that happens. But suppose you choose salmon and you don't think you made a mistake. This was the right thing to choose. But you're eating the salmon and you're thinking about the duck and you're thinking about the chicken and you're thinking about the veal. So even though you go through the meal convinced that salmon was right, you're also sorry that you had to pass up all of these other attractive things that make the salmon taste less good. So I think it's more general than, oh my God, I made a mistake. I think it's almost inevitable that we end up suffering more from the attractive things we've foregone than benefiting from the attractive things that we've embraced. And this comes right out of, as you know, prospect theory, Danny Kahneman and Amos Tversky's theory that got Kahneman the Nobel Prize, which says that losses hurt worse than gains help. And this is just another manifestation of that.
So this is the ultimate first world problem. So I think you pointed
this
out before.
This is a complete first world problem, completely.
Most humans would kill for the opportunity.
I say this every time I give talks about this. That's a point that I make almost instantly. This is the problem for people who have no problems.
So let me try to put my finger on what kind of problem it is, because there's sort of the specific claim and the more general claim. The specific claim is in the moment of choosing my meal or during my meal, I am suffering from the too large menu, from the too many options. Mm-hmm. And I think, and I know that there's actually a lot of experimental evidence supporting this, finding that
there's also evidence suggesting that you don't always get this. So people should know that there's controversy about whether the choice overload problem is a general problem, and no one has figured out what the conditions are that make it happen sometimes but not other times. So this is a hot area of controversy.
And in this way, it's exactly like every other psychological effect, where
pretty much,
all of a sudden people look at it kind of closely, and it turns out it's more complicated. But would you also argue that here's how somebody could respond to you, which says that they could say, I agree with you about specific phenomena, but still our lives are in general enhanced by being choosers, by the feeling of freedom in my everyday life. Is there evidence is there evidence for or against that?
There's 50 years of evidence for that. There's no question that that's true, which is why this recent research is such a surprise. Yes, our lives are enriched by this feeling of agency and authorship, but the surprise is that you can have too much of a good thing.
Yeah.
In addition to which, and this has not been explored, having control. How much control over your life is enough control over your life? Nobody expects to control the weather. So when there's a hurricane, it really, and your house gets wrecked, it makes you extremely sad, but it doesn't make you feel helpless, and it doesn't make you feel depressed the way other kinds of lack of control do, because nobody controls the weather.
Yeah.
And so there are going to be some areas in your life where you don't have control and you don't have choice, where it's really going to do psychological damage, and other areas not. And what determines that? And I think the answer to that question, and as I say, it's been largely unexplored, is that what happens as society broadens the range of areas where we get to make decisions is that our expectations about what aspects of life we should control keep going up. And so if you didn't expect to control where you went to college, you just went to the local college, it was no blow that you didn't control where you went to college. Once that becomes part of the menu, now it's devastating that you don't get to decide where you go to college. And so what happens is I think we make greater and greater demands of society to give us authorship over more and more aspects of life. So it hurts much more not to have control now than it did 40 years ago. Does that make sense?
It does. I'll give you an example, a sort of less significant example in college. Which is going on vacation. So I use TripAdvisor pretty regularly. Back in the day when I would travel, I'd either get a travel agent, they had those things many years ago.
Yes, they did.
To set me up with a hotel, and I'm sure it'd be nice. Or I use my guidebook, which might list 4 or 5 hotels. Now I see them all ranked in TravelAdvisor. There's tons of reviews. No matter what hotel I choose, there's always 1-star reviews. And I click on those, and I discover the hotel inevitably has roaches.
Yep.
And wherever I go, I'm miserable because, slight exaggeration, but because I always know I could have chosen better.
Yep.
and the fault is mine. The agency is mine, but the fault
That's
is mine.
the other piece of this. If you end up with a bad hotel and there was nothing you could do about it, you're unhappy you're in a bad hotel. But when you ask yourself whose fault is it, the answer is it's the world's fault. What could I do? But no one can say that about anything now. It's always your fault.
And then there's another argument against choice, which is the amount of time and energy it takes to do these things. Choices are hard, and sometimes they're pleasurable, but sometimes they're just plain difficult. I remember reading an interview with Barack Obama, and he's talking about his daily routine. And he says something, I think, which is extremely wise. He says he begins his day, he goes to his closet and goes in, and all of his suits, he has suits that are all the same. And his standard suit is just from a list of suits. He says he doesn't want to have to choose his clothing because his whole day is full of making choices, and each choice takes away a little bit from him. And he wants to have some things, easy.
Yep. Oh, look, that makes perfectly good sense. And, we all act that way. No one sits down, gets out of bed in the morning and says, let me see, should I put on my left sock first or my right sock first? There's an infinite number of choices that you make before you're even presentable to the world, except that none of us, I hope, treat any of these things as actual choices. That you rely on habit, you do whatever's closest to your elbow, and that's what makes getting through the day possible. Now, when you have a job like president, even things like deciding what to wear become equivalent to which sock do I put on first, because there are so many other more consequential choices, one after another, all day long. So I think that's right. There are economists who have written about the, quote, cost of information, so that it's not obvious that you're always better off with more information rather than less, because it takes time to acquire information, and the optimum amount of information is maybe a complicated calculation that depends on how different the various options are in a domain, how hard it is for you to acquire the information, whether you get any satisfaction out of researching what car to buy and stuff like that. But it isn't automatically true that more information is better than less, because there's a cost associated with it. And it led to a whole field in economics, the economics of information. And I think that certainly is part of the choice problem. But even when it's easy, in terms of gathering the information, it is not ever easy, I would say, psychologically. It always extracts a psychological price. Maybe it's a price worth paying, but you can't even ask yourself that question if you don't realize that there is a price. And mostly we thought that there wasn't a price. It was all good.
Right. So given the paradox of choice, the question is, how do you deal with it? And you could ask the question in two different ways. One is, I'll ask you about both, but the first would be individual strategies and individual ways in which people differ when faced with choice. And then the second is sort of as a matter of policy. And we'll get to a bit of the libertarian paternalism issues and the choice architecture issues. But you've argued that there are two types of people with regard to choice.
Yes, and just so that the people watching this get it clear, there aren't really two types of people. There's a continuum, and we've labeled the ends of the continuum. But it's more convenient to talk about them.
Two types of people.
All right. So there are people who want the best. They want the best restaurant, the best school, the best job, the best romantic partner. You name it, they want the best. We call such people maximizers. Then there are people who want good enough. And good enough is always misunderstood. Good enough doesn't mean that people have no standards. It means they may have quite high standards, but it doesn't need to be the best. A good enough restaurant, a good enough vacation, a good enough school, and so on. And the argument that we make is that faced with a limited choice set, it doesn't much matter which of these things you are, because it's not hard to look at all the possibilities. But if you're in an environment like in modern America, where there's an infinite choice set, the way to get the best, there's only one way to get the best, and that's by examining every possibility. Whereas if you're looking for good enough, you just keep examining it until you find one thing that meets your standard, and then you stop looking. You choose it. So we devised a scale that tries to see whether there are individual differences, and there are. And people who score high as maximizers seem to suffer. They're less happy, they're less optimistic, they're more pessimistic, and they're close to more perfectionistic, and they're borderline clinically depressed. Whereas people who are satisfied with good enough are happier, less prone to regret, And so it looks like you are psychologically much better off as a satisficer, which is what we call them, borrowing a term from a guy named Herb Simon. Even if you end up with less good outcomes, you will be happier about them.
So there seems to be a couple of questions of clarification. There seems to be a discovery here, which is, if I have you right, this is a sort of personality characteristic that's reasonably across the board. So somebody who is a satisficer with regard to music will be a satisficer with regard to food, and a satisficer with regard to sexual partners, and maximizer as well. Is that true?
We don't know whether it's true. What I'm assuming is that, the questionnaire that assesses these things deliberately asks about a wide variety of circumstances. But what we haven't done is taken people who've done the questionnaire and then given them choice opportunities in a wide variety of circumstances to see how general it is. So I can't absolutely claim that a maximizer is a maximizer about everything. What I think is likely true is that maximizers are maximizers about more areas of life than satisficers are.
Yeah.
There are probably some areas of life where even the worst maximizer basically doesn't care. And there may be some areas in life where satisficers care enough that they're going to put in the effort to try to find the best. But on average, if you're a maximizer, the best is the standard you're trying to meet. And if you're a satisficer, good enough is the standard you're trying to meet. And good enough, let me again emphasize, can be very good. You can have quite high standards.
So you're not saying that these are two perfectly good strategies. You're leaning in favor of the satisficer.
I think that maximizing is a terrible strategy, and I think it's a terrible strategy for several reasons. One is that the evidence is it makes it harder for people to choose, and they end up less satisfied with whatever they've chosen, even though they do better. But the other is that often it simply is impossible to succeed in maximizing because the differences among the options are so small that it's basically your effort to measure the different options the differences are more error than real. Now, what's the best college to go to?
Yale.
Is there a best college? I actually think Yale is the best college.
I don't know.
I don't know. That's the point.
It's just reflexive.
Nobody knows.
No, nobody knows.
But here you are, a star high school student, and you're applying to Harvard and Yale and Princeton, and just for the hell of it, a couple of small schools like Amherst and Swarthmore and Williams, and you get into all of them, and now you want to go to the best college. And how do you answer the question, what's the best college? There is no answer to that question because they are, in fact, equivalent. They're not equivalent in every way. Big places are different from small places. New Haven is different from Cambridge. But basically, this isn't about best. This is about would you rather be in Cambridge or would you rather be in New Haven. But you try convincing people that there is no answer to the question, what's the best college? But that's the world that maximizers live in.
No, you're right. In fact, the data show, you do these studies where you ask people, what do you think of your college? And most students, almost all students, when you get to the ones you're mentioning, are very happy with their college experience, and there's no difference.
Right. So
there's no difference.
I give talks about this as a cartoon I show from the New Yorker that really captures the problem. The cartoon is a college student wearing a sweatshirt, and the sweatshirt says Brown, but my first choice was Yale. And the point I make when I show this cartoon is, so this is the sort of quintessential maximizer. Brown is a fantastic place.
Yep.
You spend 4 years at Brown with that sweatshirt in your head, and you're not going to have a good time at Brown. Because all your time at Brown, you're going to be thinking about how, I wish I was at Yale. And it becomes self-fulfilling, right? You don't put your soul into Brown, and you get less out of it. And when you graduate, you say, Brown was okay, but Yale would have been better.
And think about it with a husband or wife.
No.
Think about living, spending your life with somebody and always wondering, have I settled? Could I have done better?
Exactly. And you see this in a more minor league way. This has always bothered me. I don't know if you've noticed this. When you go to professional meetings and you meet somebody and you're starting to chat, you'll notice that the person is not actually looking at you. The person is looking over your shoulder in case a better person walks by.
So we should have as our friends satisficers. They see us, whatever, okay, I'll settle.
You're a very good person, Paul, but even you, I can imagine people talking to you thinking, there's got to be somebody better.
So, hopefully I have friends who just don't have high standards and are willing to have low expectations.
It's really is. It's a recipe for misery and completely unnecessary and unwarranted misery.
You once told me about a diagnostic. I'm not sure if it's a scientific one, but it's a wonderful example that some people, when listening to the radio, and I'm one of them. I think I am. I'm unfortunately am a maximizer. Will listen to a song, and I'll switch back and forth, hoping for a better song. And until I get the perfect song, I'll keep going.
The items on our scale. And, you know, the way this came about is that one of my collaborators, we were sitting around trying to suggest items that might tap into this thing that we were trying to measure. And he suggested this one, you know. I'm in the car listening to the radio and the song. I like the song, but I still channel surf to see if there's a better one. And I looked at him and I said, nobody does that. And he got red in the face. And I realized that there was at least one person in the world who did that, namely him, and you're a second, and it's turned out to be the most predictive single item on the scale. So apparently lots of people do that. And, you know, what's the result, of course, is that you don't find a better song and you don't enjoy the song that you liked. Yeah. And I think that's you know, sort of in microcosm captures what's the problem with always looking for the best. And when Simon initially made this distinction a half century ago, his point wasn't about this sort of psychological downside to being a maximizer. His point was that we didn't have the intellectual resources to solve that problem. So what we needed was a standard of good enough and sensitivity to better. So you have a good enough, but when by accident you encounter something better, you switch. And what happens over the course of a lifetime is the better keeps getting better and better and better. And sort of in the limit, you approximate the best without demanding of yourself at any moment in time this exhaustive examination of all the possibilities. But his was an information processing argument and not a kind of affective, emotional argument.
So we're talking right now in terms of individual strategies that people bring to the problem. But, you know, as you well know, there's a sort of a movement in public policy by economists and political scientists to try to shape policy in ways that govern our choices. So I'm thinking right now of Thaler and Sunstein in their book, Nudge. And they argue for all sorts of reasons that governments and businesses should put in place what they call choice architectures, where there are systems of defaults and rankings designed to sort of nudge us into making certain choices over others. They're careful to say they're not taking away choices, but they want to have certain defaults and certain things that for instance, if you fail to choose, your fate will still be good. So, for instance, you could have a system where if you fail to choose where you put your money doesn't go anywhere. You lose it. But as opposed to a system where if you fail to choose, it goes somewhere and you make some return on it. So would I guess that you're a fan of these proposals?
I'm a huge fan of these proposals. I'm not sure that they solve the kind of psychic pain problem that we've been talking about. But what they do is protect people from making bad mistakes when they're faced with large numbers of options. So, you know, to take a real example that's relatively recent, when Medicare Part D was introduced, prescription drug plan for senior citizens, it was introduced to sort of inspire competition among insurance companies, and in that way, the theory goes, have better plans and cheaper ones. And what happened is that state by state, you'd have 40, 50, 80 different plans to choose from. An incredibly complicated decision because they all had different formularies. That is, they covered different drugs. They covered different drugs to different degrees. Here you are, a 70-year-old, trying to figure out which of these 80 plans is the right plan for you. So, people didn't sign up, even though they were getting a gift from the government. They had to be bullied into signing up. And then when they did sign up, they consistently made bad choices. That is, if you looked at what medicines they actually took and what plans were available, you could say, well, you chose this one, this was the 8th best one, and you passed up these other ones that are better. And then having done it in 2010, you got to do it all over again in 2011 because everything changes. So that's craziness. That is complete craziness. What's not crazy is to have a panel of experts that looks at all these proposals and identifies the 6 best and gives people a choice among those. Now, there is no bad choice you can make. You won't necessarily make the best choice, and you might care about something that I think you shouldn't care about, like how close is it to my house, is the nearest pharmacy to my house, and not care about other things that I think are more important, but you still get to make that decision. But none of the options available to you are bad because they've passed the scrutiny of people with real expertise. That makes sense to me. It preserves choice. It preserves a sense of autonomy. People can be the authors of their lives in this respect, but at the same time, you're guaranteeing that things can't go too wrong. And a default, you can't not be in the prescription drug plan. You just default into some plan if you don't make an active sale. Which plan, I don't know, you can argue about which plan is the one you want to default into. So that way you can't pass up free money. And that's the heart of the Sunstein and Thaler book. I don't think they went far enough because in their book, they were unwilling to argue for this choice architecture strongly unless there was a sense of what people actually wanted. If there was highly diverse opinion about something, they didn't want to nudge. But they did want to nudge when it came to saving for retirement because everybody wants to save for retirement. And some people weren't. So make the default that you are saving for retirement instead of the reverse. They were happy to nudge people into being organ donors because when you do surveys, 90-something% of Americans approve of organ donation, but only a quarter of Americans are organ donors. So set things up so that if you do nothing, you're an organ donor. Now what you're doing is actually honoring people's preferences, even though people don't actively elect those preferences when they're free to choose. But they're not nearly as comfortable about, making the default ice cream flavor vanilla versus chocolate, where there's no consensus. And I think they don't go far enough because their focus really is too much, in my opinion, on preserving individual autonomy and not enough on the potential public benefits of these nudges. I think it's okay to take away some individual autonomy if it contributes in a significant way to a public good that we care about. They were not willing. They were too much. Thaler's an economist. He was too much an economist to be willing to basically shove certain things that are clearly good down people's throats, even if there's an opt-out possibility.
Although, if they're that clearly good, you wouldn't be in a situation where most people would willingly not choose them. You're saying that.
Well, people are distracted, people are lazy, people, there's an enormous inertia. You do tomorrow what you did yesterday. So there are lots of reasons for people to pass up things that are clearly better than what they currently do that are not good reasons. And if you could find a way to kind of shake people and get them to pay attention, they would change their choices.
So could you give a concrete example of something that you would put in place that they would be reluctant to?
That's an interesting question. I would be much more coercive about savings. I would be much more coercive about the kind of credit that was available to people. We had complete freedom of choice in the credit market, and it was it almost brought the entire world economy down. So I think, and this used to be the case. There used to be all kinds of regulations that applied to the kind of credit you could get, the kind of interest that could be charged, and the kind of financial profile you needed to have to justify getting any kind of credit, and that's gone. I would be much more heavy-handed about structuring college curriculum. They don't talk about this, but this is salient to the college. I would, you could beg and plead and convince me that you really are unique in your need to do things, not to do things that are required and to do other things instead. But the default is this is what everybody does. You need a damn good reason.
And you would, what your work would bring to the conversation would be not only would, say, fixing the college curriculum, taking away choice, not only would that serve certain educational goals, which we could argue about, it would also make the students happier.
It would also make the students happier, exactly right. And I think I think it's great to have an argument about educational goals. I think that the way we resolve differences these days is we don't talk about them. We just give people more choice. So you think we should do a traditional curriculum? I think we should do only interdisciplinary stuff. Instead of talking through this, we let kids do either. So your view is ratified, and my view is ratified, and the only people who suffer are the poor students.
And to some extent, then it's a market failure, where if there's option A and option B, a place that offers both option A and option B is going to have, at least initially, an advantage in the market.
Yep.
And similarly, a restaurant that has a giant menu with both, say, vegetarian options and meat options will get more customers than one that just served to meat or just served to vegetarians. And added to that, I guess you're claiming that these truths about choice and the problems of choice are not accessible to us. It's what Dan Gilbert would call a failure of effective forecasting.
So this is a very interesting question. I mean, that is what I would have to say. And what economists have sometimes said to me when they've heard me make these arguments is that they can't be right, because if they were right, there would be providers would appear that gave you a simple menu of whatever it was. And because we suffer from all this choice, we would all gravitate to this simple menu.
Right.
It must be wrong, because there is a market failure and somebody should step in and exploit the market failure. I think judging from the feedback I've gotten from people, it is accessible that they are paralyzed by having too many options. But I'm not sure that they coded it that way until my book came out.
Huh.
We have a series of really difficult times making decisions, but they didn't think that this might actually be systemic. And then my book comes out and they go, so that's why I'm walking around holding my head all the time. But that doesn't automatically mean that the next opportunity they have, they go to the place that offers limited options. So I think it's not, even if you recognize that it's a problem, it's very hard to convince yourself that the next decision isn't the one where the 43rd option is going to be just the one you want, right? So go to the place that has 43 options instead of the place that has 10, and maybe, this next time will be just the right thing for you. There's also something else that I have written about, and I think it has a big role to play. And that is, I think that the way we assess our experiences is heavily influenced by what the dominant ideology is about what's good and what's bad in contemporary life. And so if the ideology, as I claim in modern America, is that choice is good and more choice is better, and freedom is the highest good and no one should tell anyone else what to do, then your experiences suffering with choice are going to be filtered through that ideology and interpreted in a sort of less germane way. At all costs is your core vision, and your core vision is that free society is a high-choice society, is a good society. So people will misinterpret their misery in order to preserve that core ideology. And I think that really is, in the 60s, this became the dominant ideology in the social sphere. Mm-hmm. In the 80s, it became the dominant ideology in the economic sphere, right? And the hippies did it in the late 60s and the early 70s, and Reagan and Thatcher did it in the 80s. So now there's like no area of life, except maybe for birth control, where this just isn't a received view, accepted uncritically. So that means that there will be market failures because no one can believe that this is a problem that can be fixed by giving people different approaches to making decisions.
Wouldn't one possible opening to address the market failure, wouldn't one possible opening be services that you could offload your choice to? And I've actually wondered why there aren't more of these.
There are more and more all the time. So, Google thought that the job was to provide all the world's information. And they discovered that when you have all the world's information, it's exactly as useful as having none. So what you need is somebody who will curate all that information, because a lot of it isn't information, it's just bullshit.
Yeah.
But you're not in a position to judge that, except in areas you know well, and the same with me. So you need curation. And more of what I see online is not, these are all the different kinds of running shoes you can buy, but these are the different running shoes you can buy, rank ordered.
Yeah.
Quality or durability based on whether you run 30 miles a week, 60 miles a week, 100 miles a week. And I think you see that more and more. And to some degree, that's one of the attractions of these social network sites, because you're now getting not like, what's that travel thing?
Travelocity? No, TripAdvisor.
Advisor. You're not getting anonymous opinions. You're getting the opinions of people who are like you. So they're valued opinions. And one of the things I actually recommend in my book is you don't always have to choose. You can call up a friend.
Yeah.
Say, what kind of cell phone did you get? And your choice of cell phone takes now 15 seconds. So I think there's going to be a lot of this recommending and curating as one way out of the choice problem. And if that gets done effectively, then it doesn't matter how many options are actually out there. You're only looking at 5. Because somebody's done the heavy lifting for you. And
it's the best of all worlds, because nobody's taken anything from me. I have the options there. No external force came and robbed me of my choice.
You don't like those 5, you just click another screen and you get 5 more. The mistake is if you click show all.
Never click show all is the...
To car radio behavior that you might be one of those people who click show all.
I do click show all. Let me ask you about some more recent arguments you've made, because I watched this wonderful TED Talk of yours on wisdom, and I found it very interesting, but I also found there was a bit of a tension between the arguments you were making there and what we're talking about now, and I wanted to explore that with you. So you gave a couple of very moving, very persuasive stories about people, judges in a couple of cases, who had a decision to make and were bound by rules.
Yep.
And they were bound by the rules, and the rules might, for the most part, be reasonable. But in these cases, the judges decided these rules were, in your cases, cruel and capricious, and tried to fight against it. And you ended up concluding that a good society has people like judges and policymakers, and actually the rest of us, not so constrained by external rules, but more freedom to express, to make decisions in a way that's consistent with our wisdom and our knowledge and our compassion. And I'll let you tell me whether I got you right, but what I'm interested in, to some extent, there's a tension between that and the paradox of choice proposal, which says rules and constraints are great. They improve our lives and they make our lives better and more fluid and happier.
Well, you're exactly right. There is a tension. And on a few occasions when I've tried to talk about both of these things in the same talk, the title is The Choices That Matter. And so what ends up happening is that I argue that, we don't need a choice among 175 different kinds of salad dressing, but we do need choice when it comes to how do you treat your students, how do you treat your coworkers, how do you treat the people who come before you when you're a judge. It is critical to have discretion and choice in those domains. It is ridiculous to have choice in the consumer domains where we are overwhelmed by it. But it's not critical to have choice in these domains just for the sake of having choice. The argument we try to make in the book is what Aristotle called the priority of the particular. Every situation is different. With some patients, if you're a doctor, brutal honesty is the right way to go. With some patients, if you're a doctor, you hide the truth as much as you possibly can, because the consequences of hearing the truth will be worse than the truth is itself. And you need to make judgments about whether this patient in front of you is the kind who needs brutal honesty or the kind who needs to have the truth massaged. You won't always get it right, but if you aspire to get it right, then you're more, and you learn from your mistakes. You get better and better at it, wiser and wiser at reading what your patients need as you spend time being a doctor. And I think what happens is that what rules are meant to do is take that discretion and judgment out of the hands of people who desperately need to use it. And I think they're put in place with good intentions, not bad ones. They're not designed to make things worse. They're designed to make things better. In the TED Talk, I suggested that rules are basically an insurance policy against disaster. Mm-hmm. But they are also a virtual guarantee that you'll never have excellence. You'll settle for mediocrity, but you won't have disasters. And this is not to say you don't need rules, but the way I think about it, rules are what get you. Rules are like a roadmap that gets you to New Haven, but none of the streets are marked. Now you'll never get to Yale unless you can get to New Haven, but getting to New Haven isn't enough to get you to Yale. So rules get you sort of into the right ballpark, and then it takes judgment and discretion once you're in the right ballpark to figure out what the right thing to do is. So respecting patients is a very important rule. Honoring patient autonomy is a very important rule, but it's a rule that has exceptions. If being committed to that rule gets you started in the right place. So you will make exceptions carefully, you will make exceptions infrequently, and you'll make exceptions in the right direction. So this is not an argument for anarchy. It's an argument for rules tempered by judgment. And we have thrown the judgment part out increasingly, partly, as I say, to protect against disaster, partly in schools. I think we have no confidence in the judgment of teachers. So the last thing you want to do is give them judgment. Instead, hand them a curriculum to follow. Because if you trust to their own judgment, they'll be terrible. So there's some of that. Partly, I think it's a worry that you're going to get sued. You stick your neck out, use your discretion, it doesn't work out, you're slapped. If you do what the standard of care is, it didn't work out, well, I did exactly what I was supposed to do. So I think there are multiple reasons why we find increasing rules, more detailed and stricter rules as a solution to problems we experience with our various social institutions, the courts, the schools, the clinics, and I just think it's the wrong solution.
I find that convincing when it comes to decisions made by somebody like you, somebody who I trust, somebody who I think is wise. But what about the decisions made by people either who I'm in a somewhat adversarial relationship with or who have power over me, or who I don't necessarily trust? So there's all sorts of cases where my intuition is a bit different. Take Miranda warning, since this is sort of in the news as we're talking. I could understand how a wise police officer could be left to his or her discretion as to when to Mirandize a suspect. I could see it really making a difference. But I might want to say, look, as a matter of policy, we're going to say you always have to do so, unless you get some sort of waiver from it. You always have to do so. And I'll recognize that this will occasionally lead you to make a stupid and immoral decision. That's the cost we pay in order to avoid the risk of incompetence or self-interest or so on. And there's 100 examples like that where if I don't trust a person, I want to have rules that constrain them.
That's right. But the mistake that people make, look, it's perfectly understandable. The mistake is to think that you can actually compensate, make up for a lack of trust if you just identify the right rules. And that's not possible. When you don't trust the person, rules protect you. But they're not nearly as good as interacting with a person whose judgment and whose intentions, just as important, you trust. You want the doctor, one, has good judgment, and two, cares more than anything on earth at that moment about your welfare. Those two things, and then you can throw the rule book away. But you don't know that your doctor is that kind of doctor. And there are also certain domains where there's no excuse for not following rules. Atul Gawande wrote this book, The Checklist Manifesto, and it's all about how if you have a checklist, you reduce hospital infections to close to zero because wash your damn hands. Now, when are the exceptions to that? There are none. So it's fine to have a rule book. But he also has written about these efforts to reduce high utilization in inner city health clinics. The pattern is you got a small, I guess it's the 80-20 rule. You got a small percentage of patients who exhaust the vast majority of resources. They're in and out of the hospital. They have multiple conditions that interact, and they cost a fortune to take care of. So what's effective with these, you got somebody who's alcoholic and obese and he eats bad food and he doesn't get any exercise. So what do? You hand him a little list. Listen, walk 20 minutes a day, stop eating sugar, blah, 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 blah. Like anyone needs this list, right? And like giving people the list is going to instantly make them do those things. What you need is you need to make the patient a partner in managing chronic conditions. And most of the medicine that gets practiced in the developed world these days is managing of chronic conditions, not curing acute ones. How do you live with diabetes? How do you live with heart disease? How do you live with chronic back pain? Patients have to be partners, and the way you make patients partners is by relating to them as individuals and tailoring your advice to the particular reality of that patient's life. And so there are these people who run intercity clinics one is in Camden, one is in Atlantic City, and they hire these staff who don't know anything about medicine, but they know how to talk to people. They know how to empathize. And they translate the doctor's stuff into a set of very specific recommendations for this patient. And they cut the utilization in the high-use patients by almost 50%. Not a rule there. It's all about knowing that person in front of you and using your judgment about the most effective way to interact with that person. So the same guy who wrote the Checklist Manifesto wrote this. It was an article in the New Yorker with no apparent sensitivity to the conflict between these two stories. So rules have their place, but that place isn't every place. Anyway, that's what we argue in them. And the importance of good intentions. Rules don't substitute for trust. You trust people is that you actually believe that they are interested in your welfare. And nothing that substitutes. Incentive schemes don't substitute for that. Incentive schemes are pale imitations of genuine concern, and I think people know that, but they put incentive schemes in place because they don't know how to nurture this trust and trustworthiness, so they do the best they can, which is to make it worth your while to act as if you actually care about what's in my best interest. And that's fine until an opportunity occurs when you do better by not caring about what's in my best interest, which surely will happen.
I find that convincing, but I find it most convincing when I think about the people who care about me, who are interested, who are motivated, who are wise. I guess my worry is, and maybe now I'm sounding like a satisficer, that often we have large groups of people who we regularly interact with who don't meet those criteria. And so I would defend rules even in cases where the rules are not perfect. So it's not like washing your hands before surgery. It's like don't racially profile, or don't always give a Miranda warning. Never have sex with your student. Never have sex with your patient. Now, we don't leave it up to police officers and doctors and therapists and everything, teachers, to make these decisions, not because the decisions are always no-brainers. Sometimes students and teachers, like say, not talking high school here, but say a college student and a teaching assistant might fall in love. And I know married couples who started off this way, so it can't be that perfect a rule. But still, it's a good rule because the people who are in a position to make that decision are never objective and never neutral. And so sometimes the rule is smarter than the person.
Look, I think that's right. Sometimes the rule is smarter than the person. It takes judgment, not rules, to know when judgment and not rules is the right way to go. So, but I agree with you. There are some things that are so sacrosanct that even though you know there will be a miscarriage of a rule, it's nonetheless worth suffering the occasional miscarriage because what you're protecting is so important. And there should be no exceptions to it. Absolutely, I agree.
My go-to example here is torture, because I like anybody else, I could easily see cases where torturing somebody would affect, in that particular instance, a greater good. The hypotheticals are easy enough. But you don't want to give people the right to torture because we don't trust anybody, and I don't think you should trust anybody to themselves make that decision.
Yeah. Yeah, but I have my own view on this. Is I think it's very important to have a rule that says we don't torture. End of story. And it's also probably important to have people who are willing to break the rule if they think this is a circumstance where large numbers of people are in imminent danger, and that can be averted if you just. So, you break the rule and you're going to suffer the consequences. But the fact that it's a rule means you will not do it except with enormous reflection. It's a rule that's meant to have no exceptions, and you are deliberately violating a rule. I have a good friend. Years ago, American Nazis would often take great pleasure in having marches in communities that were essentially 100% Jewish. And there was all this stuff about freedom of speech and freedom of assembly. And, what are you going to do? You're going to let these Nazis march? And this specific example was in Skokie, Illinois, a suburb of Chicago. So this friend of mine, this was his way of resolving this absolute commitment to freedom of speech and freedom of assembly with the unbelievable cruelty of this. He said, here's what I think they should do. I hope the people watching this don't mind what I'm about to say. Here's what I think they should do. He said, you should let them march, and then you just beat the shit out of them. So, I think you have to be willing to suffer the consequences of violating a rule that is, quote, inviolable. But I think there are really not that many rules that ought to have that stature. I think, and I also think that we seem to have the view that there are wise people and there are unwise people. And if you're one of the former, then, I'll trust you. And if not, I won't. As if this is something that's coded in the genes. I think experience makes wise people, and if you have the wrong experience, you don't get wiser. And one category of wrong experience is an experience of nothing but following the rules.
Okay.
It's not make you wiser. So you have to be willing to take a little risk in the hope that the consequence of taking that risk is that you will create wiser practitioners. The other thing I think is that most people actually want to do right by other people. They don't want to exploit them. They want to be helpful. And if you give people the opportunity to be helpful, they will. That doesn't, are there no bad actors? Of course there are bad actors. But you set a system of rules in place to catch the 5%, and you end up wrecking the opportunity of the 95% actually to do things that will improve the lives of the people they work with and for. And that just, sort of breaks my heart. I tell a story in the TED Talk about these janitors hospital janitors who have this endless list of tasks that they have to perform every day, and not a single one of which mentions another person. But a subset of these janitors, when you talk to them about their work, what they think is the most important part of their work is the way they interact with patients. And they're full of examples about how they treat the loved ones who are hanging around all day, every day, while they're very sick person either gets better or doesn't, and how you handle a patient who starts walking up and down the hall right after you've started washing the floor. And this is their job. Their job, in their eyes, is not emptying trash and washing floors. It's helping the doctors and the nurses ease the suffering and promote healing. And these are people with no skill. Basically, you can learn to do the job in a day. Very little education. But what gets them out of bed every day is the opportunity. They wouldn't work in a funeral home. They want to work in a hospital because their job is about interacting with patients. We should give people like that the opportunity instead of locking them into following a set of rules that essentially preclude all these interactions. So I think we vastly underestimate what people desire to be and what they're capable of being by locking them into a rigid rule structure just to protect against catastrophes.
Okay. So your mention of opportunity in the different places people find themselves in life is sort of a natural segue to the last thing I wanted to ask you about. I have my older son, Max, is turning 17, and he's starting to been thinking about for a while, applying to colleges and universities. And you have a somewhat radical proposal for how colleges and universities should handle a very difficult process of choosing students. And I wonder if you could tell us this.
Be happy to. Here's my proposal. My proposal is that every school look at every applicant and make a binary decision: good enough, not good enough. And the criteria at Harvard and Yale will be different from the criteria at Ohio State and Penn State. But whatever the criteria are, you look at the folder and you say, this person could do just great here. And all the people who are good enough, you put into one hat. And all the people who are not good enough, you put into the other hat. You throw those people away. And then you take the people who are good enough and you pick them at random. And you pick however many you need to pick in order to fill a first-year class. So in order to get into Harvard, Yale, and Swarthmore, you need two things. One, you need to be good enough. And two, you need to be lucky. And that's it. So you're not taking a look at, 5,000 spectacular kids and trying to find 1,000 of those 5,000 who are beyond spectacular, inventing distinctions rather than discovering them, in my opinion. And the consequence of this, I think there are several important consequences. One is it will take the pressure cooker that kids are living under in high school, just stick a pin in the balloon. Because you no longer have to be the best kid in your high school. You just have to be good enough and lucky. And I think it will transform high school experience to do this. The second thing that I think is incredibly important is that it will teach people the following, a critical lesson. We tend to think that in a just society, people deserve what they get and people get what they deserve. I think that you can imagine living in a society in which most of the time people deserve what they get. I think there's no prayer of having a society in which people get what they deserve. Every one of these kids who applies to Harvard, every one of those 5,000, every one of them deserves to go to Harvard. Every one of them. But only a fifth of them will. And I think if you appreciate that it isn't enough to be good, you also need to be lucky. You may look on people who seem not to be succeeding in life and think, well, their problem is not that they weren't good, and not that they didn't try, they were unlucky. And when you appreciate the role of luck in life outcomes, I think you're much more willing to lend a hand to people whose life outcomes have not gone well, because that really could have been you, except that you were lucky and they weren't. And there's a kind of sense that everybody deserves what they get. So people who don't have much deserve not to have much. And we shouldn't care much about the course of their lives because they had a chance and they blew it. Well, that's just false empirically. And one way of signaling to people that it's false is by being quite explicit that that getting into college is a lottery. Every college knows it's a lottery, and everyone pretends that every selective college knows it's a lottery, and everyone pretends it's not. And that does an enormous disservice to everybody, to the college, to the people who are applying, to the people who get in, to the people who don't get in, and it can be fixed like that.
Have you had any luck convincing admissions officers at Swarthmore of this?
I've had no luck. Is my own home institution. I tried to get them just to admit a third of the students this way and do a study for 3 or 4 years and see whether the outcomes were any different. I couldn't get them to do that. And when I initially wrote this article, it was published it ended up eventually getting published in the Chronicle of Higher Education, but initially it was published in the Swarthmore College Alumni Magazine. And they talked to our admissions free. And the next issue, there were several letters to the editor, and one of them, I'll never forget this, said, so we should admit students to Swarthmore by lottery. Let me ask you, is that how you hire some of your faculty members? That was the only way he could explain how somebody like me could possibly I want lottery. So I believe this more and more all the time, that there's downside and there's enormous upside, and it would only matter if one institution did it and not brought other institutions on board. You really need to change the culture, and that won't happen if Swarthmore does it this way. It needs to be, 15 of selective institutions all kind of agreeing that this is a much more sensible way to do it than the way they currently do it. I don't see that happening.
Well, I'll tell you a story that fits in with what you're saying. One of the things Yale's planning to do over the next several years is add 2 residential colleges to the ones we have, which would increase the number of students we have by, I don't know, say 20%. In our student newspaper and in conversations, many of the Yale students objected to this, saying we're now going to lower down the quality of Yale by bringing so many more people. And, which is insane. An admissions officer told me something which makes perfect sense, which is each year, instead of accepting all the people they're going to accept, they could reject all of those, accept the same number of people, and nobody would tell the difference because there is no difference.
That's my point. If that's true, then what possible justification is there for inventing differences and pretending that you're discovering them?
Maybe the pleasure of choice,
Yeah.
or the power of choice. The
News and World Report has a lot to do with this. I think the more selective you can show that you are, the more points you get in this ridiculous. And by the way, this is just the flip side. Just as colleges want to select the best students, students want to go to the best colleges, and that's exactly equally nonsensical. And so you shouldn't even contemplate walking around with a sweatshirt in your mind that says Brown, but my first choice was Yale. But that's what students do. So I think there's, the mistake is symmetrical, but it's much more consequential when colleges make it with respect to students than when students make it with respect to colleges. And, the colleges are grown-ups. They should know better, even if 17-year-olds don't. And I think they do know better, but nobody I've encountered has the courage to act on what I think is a transparently, obviously sensible thing to do.
I think you're right, but I think it'd be such a public admission of the arbitrariness of the choices that no university or no college would ever do it.
There's another reason. I think you're absolutely right. And here's something I think people in America can't abide. Nobody can abide not having control over the significant outcomes in life.
Yeah.
Hardest significant outcome, indeed it is. And the illusion that they are responsible for this result, rather than it being explicitly chance, enables them to get through the day. I don't think people are willing to face that really important things in life happen by luck. But we have to get people to grow up a little bit. And I do think it will promote much more concern for social justice than the current attitude that we don't have to worry about social justice because everybody gets what they deserve.
I've also heard the opposite proposal, which is also radical in its own way, which is you take some of the slots put aside, take students who pass that up threshold, and you have a bidding. They bid for them. Because that would also make explicit something. If your proposal makes explicit the role of luck, this would make explicit the role of money. And right now, of course, you could buy your child into a great college or university, but it's all, innuendo and tacit understanding. A bidding system would make it explicit.
I think there's a lot to be said for doing that, which shame institutions into changing the way they make admissions decisions. Because you're right, no one is willing to tolerate that explicitly.
That's right.
It maybe get people to tolerate the lottery aspects of this because, after all, there just aren't enough slots for talent. Yes. I don't think anyone would tolerate buying your way in as an explicit policy. So when it's sort of, we both know you're right, that rich people are much more likely to get into these places than not rich people are. But if you made that explicit by creating an auction, society would shut down the institutions before they allowed that to continue.
Well, we wouldn't want that to happen.
No, and we'd lose our jobs.
On that exciting note, Barry, thanks a lot for talking with me.
It was as charming and provocative as I knew it would be because of the qualities of your inventive mind. So thank you so much, Paul.
We'll talk later. Thank you.
Good.